down, discuss the pathology, and then go through proper treatment plans, because there's not one treatment fits all.
Right. Then the physical therapy, it could be a part of the treatment then, you're saying,
Yeah,
right?
that's it. Again, after the physician is able to diagnose and come up with a plan, conservative therapy would be physical therapy as well.
So you're suggesting that they see the physician first, even before they take over-the-counter medication?
That's correct.
Yeah, because we could say, let me go get some Tylenol,
right,
and get some relief of this pain. But that's not really solving
that's not solving the problem.
Yeah.
Right, it's like a Band-Aid. You know, first and foremost, you want to become educated. The best consumer is an educated consumer, and the product in this case is your health.
Yeah.
So seek medical advice first, because you might be masking serious pathology by taking over-the-counter medications, which could lead to other significant pathology.
Okay. What then is osteopathic manipulation treatment? And I know we've covered a little bit, but I want to get a little more specific,
right,
and why this is such a good treatment for those kind of, you know, because I remember many years going to the hospital for an injury that I had, and they had this gentleman in the bed next to me, and they had him, he had back problems, and when they had him with weights on his legs, and
traction.
They had him stretched out like that, and I said, there's got to be a better way for this person to get relief. Do they still do that? Because I haven't been, well, I don't visit the hospital, thank God I don't have to go, but I haven't seen that in a long time, where these weights are hanging down from the side of the bed.
That would be in extreme cases where they're doing traction. That's not standard where your first line of therapy, because the practices and advancement of technology, such as MRI, CTs, even X-rays, and our scope of knowledge has improved.
Right.
Where we're able to diagnose clinically, and then, like I said, you know, you do your simple tests, your baseline, to make sure there's no underlying pathology which is causing this. I mean, I've never seen that in my training, but it does. You do see it. That
was a long time ago.
Right. It's there. You know, severe cases, they probably do that. I've never seen it. Usually, we start off with very conservative therapy, and I mentioned a few, and I'll just go over osteopathic manipulative therapy.
Okay. That now, after you've done all of that background researching on the person. Now we're coming to the osteopathic. Is that the point where you would go and do that kind of treatment? Manipulative treatment?
Right. Well, first of all, you know, again, I have to emphasize the thorough exam. Right. From top to bottom, and just rule out the basics. Like I said, and I bring up the example of urinary tract infection. The first thing I do is a patient of mine comes in, they complain of low back pain. Well, I have to rule out certain pathology, like a renal calculi, a kidney stone. A kidney stone can give you referred pain in your lower back or your groin. A urinary tract infection, a bladder infection, can give you the referred pain, you know, to your back. So the first thing I do is I have my MAs, we do a urinary, a UA, to see if there's any blood, or to see if there's any infection, what we say leukocytes or nitrates, and this is an indicator that there's an infection. Once I ruled out an infection or a renal calculi or what we call kidney stone, and then I do my musculoskeletal exam, and then I look for pathology and changes in the biomechanics like we covered here. Let's say for this instance that there was no other pathology, there's no urinary tract infection or kidney pathology, and I felt that clinically it's all musculoskeletal, and then I offer osteopathic manipulative medicine. And then I end up treating the patient. But before I want to get into like a treatment, I like to define what osteopathic manipulative medicine is. Osteopathic manipulative medicine is what we call an adjunctive therapy, which is included with what we call traditional medicine, where you use medications to treat pathology. Osteopathic manipulative medicine is hands-on. It's where we use specific techniques that were developed over 100 years ago by Dr. Still, who's our founding father, to treat back pathology.
Right.
And we have simple techniques. There are different types of techniques that we use to correct the musculoskeletal changes. And these techniques can be as simple as isokinetics, or what we call muscle energy techniques, all to the high velocity, low amplitude, which is the harder thrusting techniques. And there's techniques that are in between that are a combination of the both. So what I do is I sit down and I look at the patient, I look at their age, I look at how, what type of technique I can use on them. I look at, if they are frail, I'll use more of a muscle energy technique versus a high velocity technique. So again, I work with the patient, and we work as a team, and we come up with a plan. And that's what osteopathic manipulative medicine is.
Well, I think we've done a thorough on the lower back pain injuries, and I know the people have been helping. Once again, we want to thank Dr. Tommy O. You're doing a fantastic job.
Pleasure being here.
We're going to move into a segment coming up in the next month, and I would like to just to talk a little bit about what's coming next. And we got just about a minute to do that, but I want to give a preview on the next show. Go right ahead. We're going to be talking, I believe, about HIV and AIDS, and we're going to define them, and coronary artery diseases. Just quickly tell us about this next segment.
Okay. Well, we're going to define HIV and AIDS. There is a misnomer where the general population feel that HIV and AIDS are the same, which they're not, and I'll have to define what are they. One is the cause, and one is it's what we call sequela, or something that happens after the infection, and that would be the AIDS, like a side effects or a pathology that happens after. So it would be an after effect, and that's what the AIDS is.
So we're going to give them a good understanding about this, okay? Well, we want to thank Dr. Tommy O for bringing us once again a very informative program, and AllMed, the clinic where he works, you'll get the address coming up on the screen. And I also want to mention that you can email me if there's any questions that you want to ask Dr. Tommy O. You're going to see the emails coming up, and feel free to call, and most of all, visit AllMed and get a good workup. And no matter what the problem is, before you self-diagnose it, go and get a clinical diagnosis. Go to a good doctor, and I would say Dr. Tommy O. I would also like to say to you that we look forward to receiving your emails. We look forward for you to visit Church Alive, and certainly tell us how you enjoy this program. Thank you once again for allowing us to bring Ask Dr. Tommy O into your homes. God bless you. Until next time.